My name is Richard Rubin. I'm a PhD and a CDE. I'm on the faculty of the Johns Hopkins University School of Medicine. I live in a place that gives me so much. I was a city boy up until just 5 years ago. Now I have the pleasure of living out in the country, north of Baltimore City. I have 6 acres, and it's a place that is so nourishing to me. I've been living here for 5 years, and every single time I go outside, I see something new. And when I travel in the great big world outside of this wonderful place where I live, it's the same kind of a thing. There's always something new for me to learn. Wherever I go, no matter how many times I've talked to people with diabetes, there's somebody who's going to get up and say something, I never thought about that before. Research is a big part of what I'm involved in at Hopkins, and it's all related to diabetes, trying to protect people from ever developing diabetes and try to improve the lives of people who already have it. Really the mission of the ADA. What we learned there was that behavior, losing just 10 pounds in people who are at high risk for developing diabetes, cut their risk of developing diabetes more than in half. The emotional side of diabetes, of course, which is my specialty since I'm a psychologist, I think is absolutely at the foundation of diabetes care and diabetes good health. It is the biggest thing that either helps people if they cope well or makes it very difficult for them to manage if they don't cope well. That's why I'm here. That's my mission, is to see to it that we understand those psychological issues as well as we possibly can, and we protect people from the negative consequences and teach them how to be the strongest possible people so that they can do the best possible job living with their diabetes. I think scientists are interested in working at the community level because they want people with diabetes to understand more about their disease and to take better care of it. So I think what scientists are looking for there is more programs for people, more opportunities personally for the scientists to contribute, but even more than that, more programs for the people with diabetes, programs like our Latino program or our African American program or some of the youth programs. Diabetes has been part of my life, and the ADA has been part of my life since 1959. Almost 50 years ago, my sister, who was 9 at the time, was diagnosed with diabetes. And one of her very first diabetes experiences was an ADA camp. Precisely, almost precisely 20 years later, my son developed diabetes, and he went to the very same ADA camp. From that point, I was hooked on the ADA, and I've been an active, dedicated ADA volunteer ever since then. Volunteers are the ADA. Community volunteers are the ADA. I started off as a community volunteer many, many years ago. I'm still a community volunteer. I will always be a community volunteer. I'm a person who likes to know that at the end of every single day, he spent himself completely. And I mean in all the things I love, that every single day, at the end of that day, I can say to myself, and I can almost every day, I've done everything I could possibly do. And then I can rest.